The Genuine Article. Discussion and commentary based on articles from JACC.
The question of whether testosterone therapy can benefit patients with congestive heart failure has long been debated. I'm Tony DeMaria, the editor of JACC, and I'm here with a paper that will soon be published that deals with this very topic. And in fact, I'm talking to the senior author of that paper, Dr. Giuseppe Rosano from San Raffaele University in Italy. Giuseppe, tell us a little bit about the study you performed.
Yeah, we studied 36 women with heart failure that we've allocated to testosterone patches or placebo, and we tested exercise capacity, 6-minute walking test, and MVO2. We also tested muscle strength and insulin sensitivity, and at baseline and at the end of the study, and we found that at the end of the study there was an improvement in exercise performance measured by both MVO2 or 6-minute walking test, and that was coupled with an improvement in insulin resistance, but also in muscle strength.
Good. Now, as I understand it, this was the first data available in women. Testosterone has been given to men before.
Yes, we had the opportunity of having a special formulation in Europe that it's used for hypoactive sexual desire disorder, which is a patch especially designed for women. So we thought that could have been a sort of replacement, physiological replacement for women, and so we tested the hypothesis, because so far all the other preparations have give too much of testosterone for women.
So in your study, the women tolerated the testosterone very well.
They tolerated very well because it's with the dose that we gave, that was 300 micrograms. The testosterone level remained within the physiological range.
Now tell me, what happened to cardiac structure and function in this study?
As we did in our previous study that was also published in JACC last year, in men, we didn't find any significant change in left ventricular ejection fraction or in contractility. What we found was the improvement in muscle strength. So we believe that most of our results are related more to the peripheral effect of testosterone rather than to a central effect of testosterone.
So you believe the enhanced 6-minute walk capability was due to peripheral musculature rather than to any intrinsic benefit in cardiovascular function?
Yes, we do. I mean, this is consistent with previous studies that our group and others have done, and also is consistent with the improvement that we saw in isokinetic and peak torque exercise that we saw.
So did you study the mechanisms, or do you have thoughts about the mechanisms of how testosterone creates this benefit?
No, we know that testosterone is anabolic, and so we know that especially if during exercise or during rehabilitation, that maximizes the effect. And so often we see patients with heart failure developing muscular cachexia, and so testosterone probably inhibits this development of cachexia through both an anabolic effect, but also through a vascular effect, because in the early 90s we've shown that the testosterone improves endothelial function and blood flow into the muscles.
So now, can you tell us, did the testosterone have any long-term effect on mortality or recurrent hospitalizations?
The study was too short, so we cannot comment on that. And I think that we first have to understand the effect of testosterone in men and see whether it has a long effect in men, and then probably we may go into women. Our study was mainly to test the muscle hypothesis and whether it's improving muscle functioning and the anabolism that could improve functional capacity in some of our patients, and mainly in those patients who tend to develop cachexia or muscular fatigue.
Yes, I noticed when we looked at your paper that your patients had severe heart failure and small BMIs, so some cachexia. Perhaps the data don't fit for patients who are less ill or patients who are obese.
Indeed. Although for the obese, what we tend to do, our way of thinking is that it's even in obese patients we may have cachexia, because if we see a loss of muscle mass over time, that is an index of cachexia and muscle defatigation. So it's probably what is important, what will be important in the future in order to understand the effect on exercise capacity is also to couple the measurement of muscle mass together with the measurement of body mass index.
Well, we'll look forward to those studies. Again, a small study, mechanistic, but more evidence accumulating that testosterone may be a benefit not only in men, but women with congestive heart failure. For Inside JACC, I'm Tony DeMaria.